Hello, I'm John Martin. I would like to make a comment about the federal response to the coronavirus outbreak. I listened this morning to Dr. Fauci and Dr. Redfield, people I've known over many years, talk about the government's response. I also listened to many conspiratorial discussions held on Facebook or YouTube about how Bill Gates is trying to make money out of vaccines, and there's just so much rubbish on that side. What's been lacking is an objective attempt to try to inform public health officials that there are areas in public health somewhat outside of the areas that they seem willing or able to address. I particularly want to focus on the assumption that there are people who are inevitably more susceptible to coronavirus infection in terms of serious illness than others. These are being identified primarily as the elderly, people with coexisting illnesses, and people of Hispanic or African American origin, and of course, a major one, people who put themselves at risk by being exposed to heightened level of these viruses in dealing with sick individuals. There were a couple of errors that occurred in retrospect. The first big one was the initial assumption that one could identify infectious people because they would have symptoms. That failed to recognize that with many epidemics, you don't necessarily have to become sick to be infected or even to transmit the virus. The best example, in polio, there was a huge outbreak in terms of many people becoming paralyzed, and yet only 1% of the people who were infected actually developed paralytic disease. In other words, 99% of people could be infected but not have symptoms. Whatever that number is with coronavirus has not been pursued vigorously. It should have been top on the list. First thing back when it was in China, coming into this country, to test not only symptomatic people, but to see how much infection is there among the asymptomatic individuals. The figures are starting to come out, and it may well be in that 1 to 2%. The second one, of the people who are infected, how many develop symptoms? And again, it's somewhere around 10 to 15% only. So the obvious question, what determines whether somebody is going to be susceptible or resistant to infection? This is where information that I've provided to these individuals, but it never took traction. Evidence on the one hand, there are viruses, which are referred to as stealth-adapted viruses, that do not engage the immune system, but they can still be resisted. And they're resisted through a non-immunological defense mechanism. And this pathway involves what I call the alternative cellular energy, or ACE pathway. This pathway is effective against stealth-adapted viruses, but we've shown over and over again that it's equally effective against many infectious illnesses, tuberculosis, HIV, herpes, rotaviruses for diarrhea, and is surely effective against coronavirus. The second one, the ACE pathway, is reflected as an added dynamic or kinetic quality of the body's fluids. This can be shown in terms of various assays. The blood circulates faster, cells can obtain this energy from water, or the energy can be placed into water. The reason I'm doing this video from this location, this is a spot in Southern California where the water from a deep well is naturally activated, every bit as much as in a number of property or number of products that are being marketed as activated water. What's great is the activity stays. I'm back here having first visited 12 years ago, and then testing some of the water that I had obtained 12 years ago towards the end of last year, and it was still active. So I renewed my contact with this location, and sure enough, it's fantastic to see the water being so dynamically active. What also we now know is the water radiates this energy, or disseminates the energy to nearby water. So that has allowed putting the water into pouches and having people use the pouch as a wearable waterceutical pouch. People visiting this location, and now increasing number of people to whom we've sent these wearable waterceutical pouches containing small quantity of this naturally activated water are benefiting from it. In particular interest for me, they're benefiting more from it than people who would be drinking the water from this location. Or even more impressive, there are many horses in this area, and people are coming back saying they're using these pouches on their horses after an exercise experience, and the horses are recovering faster. So what I see, the answer to the coronavirus outbreak is not to wait for the vaccine, not to believe that there's nothing other than the immune system that can naturally fight off the infection, but address all of the people who have an added risk for this virus by providing them with a wearable waterceutical pouch to enhance their alternative cellular energy pathway and increase their resistance to symptomatic coronavirus infection. I would be delighted to provide information, including published peer-reviewed publications on this topic, to those in the public health arena. Efforts to do so far in unsolicited proposals or other efforts have gone, never hit the mark. Any assistance from those viewing on how best to communicate this information to the wider audience, including public health officials, would be much appreciated. Thank you. I wish you were down here and could enjoy this wonderful environment. Thanks again.